again, there's so much work that needs to be done, and it requires all of us, different backgrounds, different gifts, different talents.
Hello, welcome to the channel. It's been a while, but I'm glad to be back today. The UK chapter of the Ghanaian Diaspora Nursing Alliance, GNA, is holding a health summit at the University of Westminster Harrow campus in North London. And the theme for this year is Building Systems that Empower Nurses and Midwives for Excellence. So come with me.
Bernard here, you're welcome.
Thank you.
Join a lovely summit. Registration desk to your right.
I had the opportunity to attend the summit with my daughter, who is also a nurse, and so that is us registering before going in to take our seats. It was nice to see a lot of familiar faces in the room, people that I've met in previous GDNA events, and also people that I've worked with in the past in other associations. It was great to see an array of leaders in the nursing and midwifery field. The attendees comprised of chief nursing officers, young up-and-coming nurses, retired nurses, and many other nurses and midwives in leadership roles. The talent and experience and knowledge represented in the room was palpable. UK chapter country lead Angela Gorey gave a brief summary on how GDNA started, followed by a presentation by Dr. Decker and Professor Yvonne Komodo-Mensah. And of course, we had to say
GDNA, Ghana in our DNA. GDNA, Africa in our DNA. Thank you.
So, and what is our vision? Our vision is to significantly contribute to Africa's ability to produce global nurses who are skilled and knowledgeable in specialty and advanced practice nursing areas to improve health outcomes. So keyword, what is the keyword in everything that I've just said? Improve health outcomes, right? So we continue to keep this vision, our mission to improve health outcomes. So here's our values of GDNA, it's collaboration. Collaboration, we said that earlier, integrity, resilience, perseverance, and excellence, right? What the mission that we are on? If you don't have perseverance, you're failed. It's no easy work, right? And I wanted to highlight that. And then what is the work that we're doing without excellence? We don't do half work. We do it to our fullest capacity. We do it all, we go all out, and we do it well. And here, so you have to have a plan, you have to have a strategy to get to where you're going, right? Our first strategy is education and training, then advocacy and policy, and you'll hear more about that later, research, QI and EVP, innovation and community impact. That's why we'll be at the Ghana Party in the Park tomorrow to do a health screening.
GDNA is a well-established global organization, and I would say it's a global force of nurses and midwives to reckon with. So we have the global executive team, and then we also have chapters in the USA and the UK as well. One of the key words that come across a lot in the work of GDNA is collaboration. And if you've had any experience of giving back, you would know how important it is to get your local partners on board. And so we have the Ghana chapter executive team as well as the broad team, and of course an advisory board, which is crucial to your success.
Here's our advisory council. How do you do the work in Ghana or in Africa without proper council, right? You just don't go in to act like you know everything. So when we started, we consulted with the who of nursing and midwifery in Ghana, right? Professors, our presidents for the Ghana Registered Nurses and Midwifery, our NMC leads, and all of that. So if anybody recognizes these individuals, they're the folks that we really consult with on the projects that we do in Ghana. So yeah, we're currently about 6,500 members, and we've only been around for 4 years. So people really resonate with the work that we do. And the impact we're making in our communities and amongst the nurses and midwives in Africa as well as the diaspora. And we can give many examples, but we don't have the time today. But you can speak with us individually to really see where we can support you in your professional development, or whatever area you need help with.
Professor Dr. Yvonne Komodo-Mensah shed more light on the work of GDNA and the need to expand this vision to the whole of Africa and beyond.
As Matilda said, we've been working, and when we started the work, one of the things people asked was, are you here to come and recruit our nurses from Ghana? When they heard Diaspora, they thought we're just coming to take the nurses away. And we said, no, we're actually here to give back. People talk about brain drain. We talk about brain what? Gain, right? There's so much to gain. And so we thought that it would be important to have a conversation about migration. So you can see in 2023, we had our first roundtable where we had representatives from Ghana, WHO, ICN, people joined virtually to have a focused conversation about migration. What are the reasons why people leave, and how can we address this in an ethical way? And so there were some recommendations. In the interest of time, the report is on our website. You could read more. So Matilda said community service, impact, engagement. That's a core of who we are. I think nurses have an impact not just at the bedside, but we should be visible in community. So we started in 2024 with our first conference. We said it's not enough to just have a conference. We have to serve the community. So our first conference was at the University of Ghana, Legon, and that's where we offered free CPR classes. Most of us were shocked to learn that in Ghana, nurses are not required to know CPR or do CPR. So we offered a free CPR class at the conference, and about 100 people participated. And that's our first health fair. We did it in Brenu, in the central region. You can see a lot of our team members flew in from the UK, from the US, and so all of our members have a heart for community service. And so when we also started, one of the things we heard was that there are a lot of nurses who want to advance their education, but finances, right? The average nurse in Ghana makes, I know the dollar equivalent, about $300. So anyone who can convert to pounds, that's what it is, right? It's not a lot, right? So if you want to advance your education, how do you do that? We said, okay, then let's have a fundraising campaign. So in 2024, we were able to raise about $9,000, and we gave out about 10 scholarships, and the nurses were so grateful. Because it's one thing to tell someone you support them, it's another thing to what? Show them, right? So our generous members, our supporters gave money, and we're able to present them with a check. And so they were very happy about that. So our second conference, that was last year, 2025. We did it at Labadi Beach Hotel. And one thing I'll say is GNA, every year we go, we get better, bigger and better. We always want to do things better. Excellence, as Dr. Becker said. We had 250 people who assembled. You can see amazing keynote presentations, panels. Again, CPR showed up again, and we had another health fair, this time in the Volta region. So we like to spread the love. We don't like to just go to one region all the time, so we like to move from region to region. And so this year, 2026, was our third conference, and this time we had, 432 people at Kempinski, a lot of panels, a lot of workshops. That's one thing I'll say at our conferences, it's not all talk. We want our attendees to walk away with some concrete skills. So we had a number of workshops you can recognize. Angela over here, she did a workshop on clinical trials. So this is the amazing expertise that we have in our organization. So we hope you will join us in Ghana next year, January 7th to the 9th. So this was our 2026 health fair. This time we went to the Ashanti region, and we served over 1,000 people in the Ashanti region. Advocacy, Matilda talked about this. Nurses, we have a voice. We need to use it, right? We are learning that it's very compelling when a Ghanaian nurse shows up on Capitol Hill to say, you know that USAID grant that you're cutting that is impacting people who have HIV/AIDS, like it affects my loved ones. It's very powerful. They listen to you, right? So we had our first Hill Day on March 6th of last year, and there was actually a session that was happening at the same time, and they were talking about HIV, and they said, oh, wouldn't it be nice if we had African diaspora organizations who were present on the Hill? And we said, we're here. We're here. And they were shocked that it wasn't just nurses, it was physicians, so it was really a transformative experience as well. And we also partnered with CARE International. So CARE introduced us to advocacy. So CARE is in over 160 countries all over the world. This year we were on the Hill again, and partnered with FIGS as well to advocate for healthcare workers. So our work not only touches Africa, but we are very passionate about global health and anything that affects the nursing profession. So we had a reception in Helsinki last year, another way of partnering and collaborating with other African diaspora organizations. So I think perennial suturing. So Adelaide is not here yet. So this is one of our members, Adelaide, before. Yes, I think that's her last name. Yeah, Adelaide. So she's a certified nurse midwife who's an expert in perennial suturing, who's new to Ghana to offer a workshop for midwives. And perennial suturing is an important skill that midwives should have, and it's very compelling that she, a Ghanaian living in the diaspora, was able to go back home and offer this to Ghanaian midwives. This is another workshop that we've done at our conference, focused on postpartum hemorrhage. Breast cancer, this year's workshop, we also had a session focused on breast cancer as well. So one of our biggest accomplishments, this one I have to pause, because it's so surreal to me. If you go back one slide, so how many of you know about the Johnson & Johnson hackathon? Yes, a couple of people, yes. So we competed, and we competed against big hospitals that have been in existence for decades, and GNA won the top prize. So, this is our civilization. So we said, well, you have midwives who may be trained but unemployed, and we have technology like point-of-care ultrasound devices that are fairly affordable, right? And you can take a novice midwife, you can train them, you can give them a device, and they can detect peripartum cardiomyopathy. And so this was the idea we pitched, and they thought it was amazing, and we agreed it was. And so we actually did the training. This was last year. You can imagine when physicians hear that nurses or midwives are using point-of-care ultrasounds, they're like, hey, this is not something nurses or midwives do. And this is what Prokodunu said. He said, in his village, there's no doctor. Who was providing the care in his village? Mm-hmm. What do you think? There's a nurse. Mm-hmm. So he said if there's no physician, he will do whatever he can to make sure that the nurses are empowered to do this. And now we're expanding Mama CBD. So the first part was just a proof of concept to show that you can. You can take a novice, they'll go through the modules, and then have an in-person training. The next step is actually to buy the devices. So this is why funding matters so much to us. So we got a grant from Health Council Foundation. In January, they're going to do another training and actually give out devices to midwives who are living in rural areas.
Yvonne just mentioned Dr. Kovanu's experience in his village, more taking care of our community. So this is why the stakeholder meeting on advanced practice was important. In February, we had the opportunity to host a stakeholder meeting alongside the University of Huddersfield and the ministry and obviously GNA. What was the mission of this? To really, bring or start a project on how to get advanced practitioners in Ghana. We have nurse practitioners, we have specialist nurses, but they don't have the proper training to be considered advanced practice on a global standard. So in recent years, the WHO has mentioned that the shift for our healthcare system to have a sustainable healthcare system is to have our nurses also become advanced practitioners in our rural areas and our villages that do not have physicians or that are not willing to go there. So we have started a conversation. How does the government come along with us? Because I am a nurse practitioner, right? Brenda's a nurse practitioner. I own my own practice. And in the community that I live in, we don't have a lot of physicians. So I come along and provide primary care to our people, and they appreciate me, right? And it's not about what I do. It's about how we can really empower our nurses and midwives in Ghana to go back, get advanced degree. And that is part of our vision, to get advanced degrees, to be able to properly care for their community. So what does it mean? Us coming in, get funding, create a framework, work with the NMC to have a registry, but also to be able to implement, create jobs for all of them. So this is just the beginning of our conversation, but we're also trying to get more grants to be able to implement this. So here, especially my team, we mentioned the first year we did our fundraiser, we gave $9,000. If you're listening, I should have waited. We gave $9,000. This year, it would have been $20,000, and I was in Ghana to be able to present this, right? And this is for the advanced practitioners, right? For specialist nurses. So this is really a passion for us. So even when we were selling T-shirts outside, all that money goes back to the work that we're doing. So please buy a t-shirt. So yeah, and then mentorship, I mean, like I said, the stories are endless. The work that we've done for our nurses and midwives in Ghana, even in the diaspora, whether you want to get into this college, you want to get here, grow here in your profession, we've been there alongside with everybody that is looking to grow. So here are some of the webinars we've done. We've had the opportunity to collaborate with the WCEA, World Continuing Education Alliance, to really bring all the expertise that we have within our membership. And you can see all the webinars and who has attended. All right, so ADNA conference. So first one, yes, the summit, we're here. Our next step is our next event will be in the US, which is next month, our global conference at Hopkins. And then go back home in January to Ghana, and I'm hoping to see everybody there as well.
So as we said, when we started, we were thinking it's about Ghana, that's where we're from. Matilda and I met each other, and she walked up to me and was like, oh, you're from Ghana, I'm from Ghana, what are we gonna do? And somehow, there are people who learned about the organization and didn't care that we had Ghanaian in the name, because we started checking our membership database. We have Nigerians, Cameroonians, Ivorians, Kenyans. So we started asking questions like, how do we create an inclusive space? So not getting rid of our identity. And this is one thing that I want to make clear. So GDNA is never going away, right? That's our history, but we're growing. And so we are also doing business as the African Diaspora Nursing Alliance. We're still GDNA, the name is not going away, but ADNA, we want to be inclusive. Yes, we want to honor, and this is one thing I'll say, there have been concerns about, well, how will the Nigerians feel and the Kenyans feel? We want to make it clear that we're not here to take over anything. There's a lot of work that needs to be done, and there are certain spaces, I have to say, that we are stronger with together. So if there's an opportunity that affects Kenyans, we are not going to pretend to be the experts, right? We're going to look to the Kenyan organizations to lead where we support and bring on other collaborators. It's something, actually, there was a grant opportunity. They said they want to do something in Nigeria focused on hypothyroidism. We said we're connected to NANA, so that's a Nigerian organization in the US. I'm connected with the president. We're going to work with them. They're going to take the lead. But the umbrella organization is what? The African and Diaspora Nursing Alliance. Yes, thank you. It's still us, right? We're doing the work. We're bringing more people into the fold because there are some people from small African countries that don't belong to an association, right? Where do they find a home? How do they see themselves represented? So you can be a member of multiple organizations. We're not asking people to choose. We just want to continue to do the work. And the last thing we'll see is when we apply for funding, one of the challenges we've heard is that, oh, yes, you're doing this that only supports nurses from Ghana. It's been limiting, right? So we wanted to make sure that our identity is reflective of the broad reach that we have as an organization. And you said there's 6,500 members. By next year, we're going to double that. Mm-hmm. Again, there's so much work that needs to be done, and it requires all of us, different backgrounds, different gifts, different talents. So we hope that you will join us in this work. So, thank you.
We then had the first guest presentation from Yvonne Hunt, Chief Nursing Officer at Kent and Medway NHS Foundation Trust. She shared her personal experience and also what her experience has taught her about how she shows up at work in terms of bringing her authentic self to work, her values, her voice, and fulfilling her responsibility in her role. It was a story of resilience, perseverance, and never giving up, which was inspiring to most of us. Then we had Oliver Soriano, Chief Nursing Officer at Lancashire and South Cumbria NHS Foundation Trust. Oliver shared his story of coming to the UK in 1998, having been a senior nurse lecturing in his home country and coming to the UK to start at Band 4. He talked about the support he received along his career progression to becoming the first Filipino nurse to become a Chief Nursing Officer in an NHS Foundation Trust. He said leadership is a decision to utilize opportunities that come our way, being resilient and leading wherever you are. Leadership is not a position. It's about influencing and asking, is there anything I can do to improve the care I provide? He said leadership is to empower people to believe they can make a change for the better, and also make sure you respect people along the way. It's now time for the first panel discussions, which was very interesting.
Randomly, I'm just going to pick and choose. So, Rahi, I want to ask you, obviously, as the leader for the Sikh Nurses Association, what are some of the barriers that continue to prevent nurses and midwives from our Black minority ethnic background reaching senior positions? And how can organizations like yours support to address that?
I think one of the key things that happen here is the inability or the barriers that come across in terms of career progression. One of the things that we've done with RCN Foundation research is it's under review at the moment. It's a systematic review looking at career stagnation and leadership opportunities from those from internationally educated nurses. And what we found is there's a real blocker for Band 5 nurses from those from internationally educated countries that cannot progress. And there's several reasons for that in terms of it. It's about recognising your prior learning, recognising your position for career development. Many of you will come to this country, and I've heard now we're doing interviews for the third stage of it, is harrowing stories of when they come in from Band 4. Certainly Oliver attested to this when they come to Band 4. So it's really about thinking about your recognition. On average, internationally educated nurses come to the UK with 7 years experience, and then they're at Band 4. And that's just unreasonable.
The full details of the 2 panel discussions will be available in part 2 of this video. Meanwhile, let's listen to what the attendees had to say about their experience of the summit and what they took away.
It's good to come here and collaborate with other associations to also learn from them. My takeaway today is that we have to work together as organizations. We have to learn to speak up for our nurses, and you yourself, you have to take the initiative to join an association, to join a union, so that you are able to be supported within your career. So nurses and midwives, don't keep quiet. You need to speak up.
Today's conference at GNA was absolutely amazing. Lots to learn, lots of reflection, lots of leadership. It was fantastic seeing an array of leadership and lots of great nurses that are doing absolutely amazing, formidable work. Lots of nursing. And more so seeing colleagues from GNA from America across the globe come to this conference. And it's been a real mix of everyone coming together, all the Diaspora nurses coming together from the Philippines, from here, from South Asia. So it's really been fantastic and such a learned experience. And I'm very privileged to have been. Thank you.
It was a lovely healthcare summit, and it's a privilege to be part of it as the Diaspora organization. And I encourage everyone to be part of this group because they're doing amazing work in the UK, in America, and also in Ghana and all over Africa. So it was very good to know that it's also all Africa, not just Ghana. So thank you so much, and God bless you for all the work you're doing.
This has been a really stimulating and moving event. Just understanding a little bit more about what global nurses and midwives are contributing to the UK health system, some of the challenges they're facing, but some of the solutions they're finding, and the resilience, the strength that's really being demonstrated has been quite remarkable. There's so much that we can learn from the experience of these global nurses and midwives, and I think that's something that certainly the UK health system can benefit from and is benefiting from incredibly. And that's something that Global Health Partnerships we're really keen to try and support and engage with as much as we can.
This is my second GDNA conference summit, and I've really, just like the first one, this probably outdid the first one. I learned so much more. The discussions, the panels, it was amazing. The sheer fact of not being scared to speak up when we have problems, joining a community of people. You know, it's very, very important. And also, like Dr. Nim said, we've got to the ceiling, we need to just break the ceiling and go through. It's been inspiring. It's given me that drive again to go back and actually put in the work and move forward.
It's been really inspiring.
Today's conference has been lovely. My takeaway that I want to share with everyone is always stay connected to a family, always stay connected to a tribe that identifies with you, that is ready to support you all the way through. And watch out for ADNA and GDNA, and you'll love the experience.
I have really had a lovely day, a very inspirational day, informative sessions. The speakers were all brilliant. God bless GDNA.
The conference today, the Ghana Diaspora Alliance conference. Very informative. If you missed it, you missed out. We had really collaborative working, we had panelists, and actually it was such a really insightful summit to be at. So honestly, you just had to be there. It was really nice to network, the food was amazing, and to meet nurses across the US and greater places of the world. So yeah.
The summit has been impactful. The messages from the founders and also the speakers have also been so impactful, and I'm so happy to be part of it.
It's been an amazing day for the GNA-UK Healthcare Summit, building systems that empowers nurses and midwives for excellence. And we've had such an amazing day in terms of the speakers, the caliber of speakers we had, the chief nurses, the chief midwifery officers, you know, was just incredible. And I am so grateful for everybody who attended. The room was full, the energy was high, the content was excellent. And I'm leaving with that kind of gratitude to say thank you, everyone who made it. We thank our leaders, the president, the vice, the global leaders who came with from the US. Thank every participant. And I think I'm leaving a better nurse, to be more resilient, to make sure that my voice is heard, to make sure I advocate for others, for the vulnerable, and also speak up for my own self. And I think one thing I'm taking home is about looking after myself even more. Self-care is not selfishness. Thank you so much.
Today's event has been really successful. As global nurses, it's really important that wherever we find ourselves, we build that community. It's good for our mental health, it's good for networking, it's good for development. And I'm really glad and grateful to all the special guests that came today. There was loads to learn, there was loads to share, and we're all smiling and laughing and having a good time, which is, to me, the most important. So I'm looking forward to what the future holds, and I'll encourage every nurse, you know, like Oliver said, you know, and some of the key people in the room, be part of an organization. This is how you learn, this is how you get support, this is how you get mentorship. I'll encourage every Ghanaian nurse to join the Ghanaian Diaspora Nursing Alliance, and I look forward to our next networking event.
So it's been such a great day. The travel was completely worth it. It took me a while to get here, but I'm so grateful to be here to meet and mingle with our UK execs and the rest of the UK GNA team. I think it was 2 years ago that we just had our first mingle, first networking event, and we're here again for a proper summit. And I'm just excited about all the things that we're able to share with our UK members, and we're looking forward to continue to grow and share more knowledge and our skills and our talents that we've acquired over the years, and obviously to also take it back home. So it's been such a great day.
Hello, I'm Yvonne Commodore Mensah. I'm president and co-founder of the Ghanaian Diaspora Nursing Alliance, and we just concluded a wonderful summit right here at the University of Westminster Harrow campus. Our theme for this year's summit is building systems that empower nurses and midwives for excellence. And it's been an incredible meeting. We had wonderful keynote presentations. We had panel discussions. This was truly remarkable. I think for me, one of the biggest things I've walked away with is the importance of this community, of this GDNA community. So GDNA, we see Ghana in our DNA, but we also say Africa in our DNA because we need each other now more than ever. We need to support each other. So for anyone who heard about this summit later, or you're just watching this video, please join GDNA. Go to www.g-dna.org or adna.org, www.a-dna.org. Join us. We are very inclusive. We welcome all nurses. You don't have to be from the African diaspora. You just have to be passionate about global health. And thank you so much to our sponsors, our presenters, our attendees for making this a hugely successful event. And the last thanks goes to our leaders. So I give to Marky, Angela Gori, and the whole UK exec team for making this meeting memorable. Thank you.